This is a bony anatomy review of the wrist and hand. As previously described, the forearm consists of two bones, the radius and the ulna. This is a left forearm, wrist, and hand that is slightly pronated, so it has been rotated for the benefit of your view. The ulna, of course, is the medial most bone. Proximally, the shaft of the ulna is relatively thick, but as it tapers, it diminishes in its diameter. At its narrow distal end, we have a couple of bony landmarks. We have the rounded head of the ulna, and along the most medial aspect of the head of the ulna, we have a small projection, bony landmark here, which is the ulnar styloid process. Of note, the ulna does not articulate directly with the carpal bones of the wrist. Instead, it is separated from the carpals by a fibrocartilaginous articular disc within the TFCC. Laterally, we have the shorter of the two forearm bones, the radius. We previously discussed the bony landmarks at its proximal end. Unlike the ulna, the radius, as we move distally, actually enlarges and becomes thicker. The medial aspect of the distal end of the radius forms a small concavity where the head of the ulna sits. This is known as the ulnar notch. If we remove the ulna, you'll be able to see that small indentation here. We'll bring the ulna back in. The lateral aspect of the radius ends distally, similar to the ulna, in a styloid process, seen here. This is the radial styloid process. This styloid process is larger than the ulnar styloid process, and if you look at a line drawn straight across the end of the two bones, you notice that the radial styloid process ends more distally than the ulnar styloid process. This relationship is clinically important when the ulna and/or radius is fractured. Unlike the ulna, the radius does articulate with the carpal bones, at least the proximal row of carpal bones, specifically the scaphoid and the lunate. If we look at the dorsal or posterior aspect of the radius, you'll notice one additional bony landmark if we zoom in here. There's a small ridge and bump as outlined here. This is the dorsal tubercle of the radius, or Lister's tubercle as it is more commonly known. This tubercle lies between two of the shallow grooves along the distal end of the radius that I can draw in here, there and there. These grooves allow for passage of multiple tendons for the forearm, wrist, and hand muscles. And the Lister's tubercle serves as a pulley, if you will, for the tendon of the long extensor muscle for the thumb. So the extensor pollicis longus. Moving into the wrist is composed of 8 bones divided into 2 rows, a proximal and a distal row. These bones are known as the carpals. These bones allow for flexibility within the wrist. And what's of interesting note clinically is the relative convexity on the dorsal aspect and the relative concavity on the palmar aspect. Although we don't typically consider them to be mobile bones, each of the carpals glide on one another, allowing for augmented movement at the wrist. Looking from lateral to medial, the 4 bones of the proximal row of carpals are as follows. The scaphoid, which is sort of a boat-shaped bone. This bone has a prominent tubercle on it. If you look at the bone from the lateral view here, you can see that projection here. Moving medially from the scaphoid, we have the central bone of the proximal row of carpals, which is the lunate. Luna in Latin means moon, so this is slightly moon-shaped. It's also broader anteriorly than it is posteriorly. Medial to that, we have the triquetrum or triquetrum. This is sort of a pyramid-shaped bone, almost triangular, hence its name, tri for three-sided. And sitting above that, or on top of it, is a pseudosesamoid bone known as the pisiform. It's relatively small, round, similar to the lunate, and it serves, similar to the Lister's tubercle, as a pulley for various musculature within the hand. Looking at the distal row of carpals from lateral to medial, first, sitting under the thumb is the trapezium. That's how I always remembered it, was trapezium, thumb. So it sits under the thumb. Next to the trapezium is the trapezoidal-shaped trapezoid carpal, which is going to articulate and sit under that second metacarpal bone. Medial to that, under the third and fourth metacarpal bones. In the center of the distal row of carpals is the capitate, sort of the head of the carpal bones, if you will. It's by far the largest carpal bone. And then medial to that is the slightly oddly shaped and almost hammer-shaped hamate, which in Latin actually means little hook. And as you can see, it does have that anterior projection, the hook of the hamate. This serves as an important attachment site for various ligaments, as well as the palmar aponeurosis of the hand. Extending distally from the carpals, we have the long bones of the hand, the metacarpals. Each metacarpal has a base at its proximal end and a head at its distal end. The heads of the metacarpals articulate with the phalanges and form the metacarpophalangeal joint, also more commonly known as the knuckles of the hand. The first metacarpal, which is of the thumb, is the thickest of the metacarpals, but it's also the shortest of these bones. Continuing distally into the fingers, each finger, at least fingers 2 through 5, are made up of 3 separate phalanges if we look at it from a medial view here. Okay, we'll zoom in. So we have a proximal phalange, a middle phalange, and a distal phalange. The thumb is different in that it only has a proximal and a distal phalange. Again, the articulation between the metacarpal and the proximal phalange is known as the metacarpophalangeal joint. The articulation between the proximal phalange and the middle phalange is our proximal interphalangeal joint. And then the articulation between the middle phalange and the distal phalange of fingers 2 through 5 is the distal interphalangeal joint, or DIP. The thumb, because it only has a proximal and a distal phalange, only has one articulation, which is the IP joint, the interphalangeal joint. Similar to the metacarpals, the phalanges have a base proximally, a head distally, and a shaft in the middle.